If you're over 60 and you take a blood pressure pill every day, I want you to pay very close attention to what you're about to hear. Because the most dangerous mistake many people make isn't forgetting to take their medication. It isn't eating too much salt. It isn't even having high blood pressure in the first place. The most dangerous mistake is assuming that because a pill was prescribed, there is nothing left to learn. Every single day, millions of adults over 60 swallow a blood pressure tablet with breakfast, a cup of coffee, or a glass of water. They trust that the medication is doing its job. And in many cases, it is. But what many people never realize is that their body may be sending signals long before a serious problem develops. Signals that are often mistaken for aging. Signals that are blamed on stress. Signals that are dismissed as poor sleep, a busy week, or simply getting older. The truth is that some symptoms deserve attention, not because the medication is bad, but because understanding how it affects your body can help keep you safe. I'm not here to scare you. In fact, I want the opposite. I want you to feel informed, confident, and in control. Because when patients understand their medications, they make better decisions, notice problems sooner, and avoid complications that could have been prevented. Let's start with something most people never hear. Blood pressure medication is not one thing. Many people talk about blood pressure pills as if they're all identical. They're not. Two people can have the same blood pressure reading, yet be prescribed completely different medications. Why? Because different drugs lower blood pressure through different pathways inside the body. Some relax blood vessels. Some influence hormones that control fluid balance. Some affect how the kidneys regulate pressure. And because they work differently, they can create different experiences. That's why comparing your medication to your neighbor's medication rarely makes sense. Your body is unique, your health history is unique, and your response may be completely different. One person may take a medication for years without a single issue. Another person may notice symptoms within weeks. Neither experience is unusual. One of the biggest mistakes older adults make is assuming every symptom must be unrelated because they've been on the medication for a while. But some effects don't appear immediately. Sometimes changes develop gradually. Sometimes they are so subtle that they become part of daily life before anyone notices. Imagine waking up each morning feeling perfectly fine. Then by evening your shoes feel tighter, your socks leave marks around your ankles, your legs feel heavy. Nothing dramatic, nothing painful, just different. Many people automatically blame age. They assume circulation is worsening. They assume they're gaining weight. They assume it's normal. But certain blood pressure medications can contribute to swelling in the lower legs and ankles. When that happens, the answer is not panic. The answer is awareness. Because the sooner a symptom is recognized, the easier it becomes to discuss solutions with a healthcare professional. Now let's talk about another symptom that confuses people all the time. A dry cough. Not a cold. Not an infection. Not allergies. Just a stubborn cough that refuses to leave. Some people spend months trying cough drops, teas, humidifiers, and home remedies without realizing the medication could be contributing. What makes this especially confusing is timing. People expect side effects to appear immediately, but sometimes a cough develops weeks or even months after treatment begins. That delay makes the connection harder to recognize. And because the cough isn't usually dangerous by itself, many people tolerate it far longer than necessary. The important lesson here is simple. When something changes, pay attention. You don't need to diagnose yourself. You don't need to panic, but you should notice patterns. Patterns tell stories. Patterns help doctors identify what might be happening, and patterns can prevent months of unnecessary discomfort. Now let's discuss something far more serious: hydration. This may sound boring. It may sound too simple, but hydration can completely change how your body responds to medication. Picture this. You've had a stomach virus. You've been vomiting. You've had diarrhea. You haven't eaten much. You haven't been drinking enough fluids. Yet you continue taking every medication exactly as usual. Many people believe that's the responsible thing to do. Sometimes it is. But sometimes illness changes the situation dramatically. When your body becomes dehydrated, blood pressure can fall lower than expected. Kidneys may become stressed. Dizziness can become more pronounced. Weakness can increase. And suddenly the medication that worked perfectly last week may affect you differently today. This is why communication matters. Your body is not the same during illness as it is during normal health. The context changes, and understanding that fact can prevent avoidable emergencies. Another issue that surprises many adults over 60 involves over-the-counter medications. People often separate prescription drugs from everything else. They'll carefully tell their doctor about prescribed medications while forgetting to mention pain relievers purchased at the local pharmacy. But over-the-counter products matter. They matter a lot. Some pain medications can interact with blood pressure treatment in ways many patients never expect, especially when used regularly, especially when combined with dehydration, especially when kidney function is already being monitored. This doesn't mean those products are automatically dangerous. It means they deserve the same respect as prescription medications. Always remember this: just because something doesn't require a prescription doesn't mean it cannot affect your health. Now let's talk about dizziness. Perhaps the most underestimated symptom of all. Many older adults have experienced that moment. You stand up. The room briefly shifts. You feel lightheaded for a second. Then it passes. Most people laugh it off. They tell themselves they're tired. They tell themselves they moved too quickly. And sometimes that's true. But repeated dizziness deserves attention. Because for someone over 60, a few seconds of instability can change everything. Falls remain one of the most serious health risks facing older adults. Broken hips, head injuries, hospital stays, loss of independence. These outcomes often begin with a moment that seemed insignificant. That is why symptoms should never be measured only by discomfort. They should also be measured by risk. A symptom doesn't have to feel severe to create serious consequences. Now let's address another common misunderstanding: blood pressure numbers. Many people become emotional prisoners of a single reading. One high number and panic sets in. One low number and fear takes over. The monitor becomes the boss of the entire day. But blood pressure is dynamic. It changes throughout the day. Stress affects it. Pain affects it. Sleep affects it. Activity affects it. Even worrying about blood pressure can affect blood pressure. That is why healthcare professionals look for trends rather than isolated moments. Patterns matter more than snapshots. Consistency matters more than individual readings. The goal isn't perfection. The goal is stability over time. This understanding alone can save people enormous amounts of anxiety. Now I want to discuss something that almost nobody talks about enough: the emotional side of medication. Many patients quietly struggle, not because the medication isn't working, but because they don't like how they feel. Maybe they're tired. Maybe they're frustrated. Maybe they're worried about side effects. Maybe they're afraid of becoming dependent on medication. Instead of discussing those concerns, they keep them to themselves. Weeks pass. Months pass. Eventually, they begin skipping doses, then missing doses, then stopping completely, not because they wanted to, because they felt unheard. Here's the reality: good healthcare is not just about lowering numbers, it's about creating a plan that works in real life. A medication only helps if a patient can realistically stay on it. That means comfort matters, understanding matters, communication matters, and quality of life matters. Never assume you must suffer in silence simply because a prescription exists. Speaking up is part of good healthcare, not a sign of weakness, a sign of partnership. Let's talk about another hidden issue: routine. People underestimate routine, but routine is one of the most powerful tools in blood pressure management. The body loves consistency. Taking medication at approximately the same time each day helps create stability. When schedules become unpredictable, problems become more likely. Missed doses happen. Double doses happen. Confusion happens. That's why creating a simple daily system can be incredibly valuable. A pill organizer, a phone reminder, a calendar, anything that reduces guesswork. Because blood pressure medications are designed to work steadily, not sporadically, not emotionally, not based on whether today's reading feels good or bad. Steady treatment produces steady results. Now let's discuss the kidneys. Many people fear any mention of kidney function, and understandably so. But here's what matters: your kidneys play a central role in regulating blood pressure and fluid balance. That's one reason blood tests are often part of treatment. Monitoring isn't a sign that something is wrong. Monitoring is a sign that someone is paying attention. Think of it this way: pilots don't check instruments because they expect disaster. They check instruments because that's how safe travel works. Medicine is similar. Monitoring allows small adjustments before small issues become larger ones, and that principle extends beyond blood tests. It applies to symptoms too. Your body provides information every day. Energy levels, swelling, sleep quality, breathing, dizziness, appetite, strength. These clues matter. They create a picture. And the clearer that picture becomes, the easier it is to make good decisions. One thing I've learned over the years is that the healthiest patients are rarely the ones who know the most medical terminology. They're the ones who pay attention, the ones who notice change, the ones who ask questions, the ones who refuse to ignore what their body is trying to communicate. That's the real skill. Awareness, not fear. Awareness, because fear causes panic. Awareness creates action, and action creates safety. Before we finish, I want you to remember something extremely important. Most people taking blood pressure medication will never experience a dramatic emergency. Most people do very well. These medications have helped save countless lives. They reduce the risk of heart attacks. They reduce the risk of strokes. They protect organs from years of uncontrolled pressure. That success should never be forgotten. But successful treatment doesn't mean blind treatment. It means informed treatment. It means understanding why you're taking the medication. It means recognizing warning signs. It means staying engaged in your own health. If you're over 60, don't make the mistake of assuming every symptom is simply age. Age can explain some things, but not everything. A new symptom deserves curiosity. A persistent symptom deserves attention. And a concerning symptom deserves a conversation. You don't need to become your own doctor. You simply need to become an active participant in your care. That shift alone can change everything. Because the people who stay healthiest over the long run are often not the people with perfect numbers. They're the people who understand what's happening inside their bodies. They're the people who communicate. They're the people who notice changes early. They're the people who ask questions before small problems become large ones. And perhaps most importantly, they're the people who understand that taking a blood pressure pill is not the end of the story. It's the beginning of a partnership between you, your body, your healthcare team, and the decisions you make every single day. So tomorrow morning, before you take your blood pressure medication, take a moment, not to feel afraid, not to feel worried, but to become aware. Pay attention to your body. Pay attention to changes. Pay attention to patterns. Because knowledge doesn't replace treatment, it strengthens it. And sometimes the difference between a health scare and a healthy future is simply understanding what your body has been trying to tell you all along.